to the Oral Health Education Series, Module 8, Clinical Care, Part 2. I'm Dr. Brecky, and I'm here with Ready, Set, Smile to continue talking about clinical care in dentistry. So let's review the dental team. And just remember, this now includes you. So who are the members of the dental team? In office may include a combination of the following: a dentist, a dental therapist, a dental hygienist, a dental assistant, a nurse, which is more common for an oral surgery practice, a receptionist, an office manager, a billing specialist, and in some cases, even a dental lab technician. Dentists and their varying subspecialties include general dentistry, pediatric, periodontics, endodontics, prosthodontics, orthodontics, oral surgery, oral pathology, oral radiology, public health dentistry, and also dental anesthesiology. Just remember, 1 in 5 dentists in the US are part of a clinical subspecialty. And lastly, we talked about dental teams outside the office, which may include communications with or referrals to nurses and primary care providers, physician specialists, dietitians, nutritionists, speech pathologists, physical therapists, social workers, mental health therapists, and dental lab technicians. And this isn't a complete list, but this is some. Anyone who might help and be a part of the dental team. So you will have the tools to educate others. So what can someone expect who has never been to a dentist? What's going to happen? And what kind of dental care will I have? So first, let's talk about preventive care. Preventive care includes typically measuring the health of periodontal tissues, the gums, assessing for oral cancer, and screening for dental caries or cavities. These are key components to every single dental exam. X-rays, checkup exams, cleanings, fluoride applications, oral cancer screenings, and even blood pressure assessments are all a part of preventive care one can receive in a dental office. So what's oral cancer screening? Well, this is when your doctor will tell you to stick out your tongue, or they might grab it with a big piece of gauze. Looking underneath and on the sides and on the back of the tongue are key spots to assess for oral cancer. And that's something that will be done at your dentist or perhaps by your hygienist. Open big and show your gums. A periodontal assessment includes the use of this little probe and measuring the gum tissue attachment around every single tooth. Sometimes it feels like a tickle, other times it can be a little bit more painful for people if they do have a little bit of gum disease. But it's key in understanding the severity or any extent of periodontal disease one might have. Now, did you say X-rays? Don't I get enough radiation? Well, dental radiographs or X-rays are an essential component of a dental exam. Radiation received in regular digital dental X-rays, such as bite wings, is incredibly low. More radiation is received from foods consumed each year, like potassium, and that's from today's RDH, if you've heard of that publication. There's a lot of material out there talking about the level of radiation in digital dental X-rays and how low it is. And it can be confusing for patients who may say, receive a CT scan at the doctor's office, and then they typically end up being a little bit more weary of the radiation from dental X-rays. But just know that it's really important to educate patients. Now, protection with a lead shield is neither necessary nor required for most patients. Pregnant patients and those with a history of thyroid cancers should consider wearing the lead shields. So why should they care about my blood pressure? The dentist? Well, just remember, hypertension is also known as the silent killer. Many people who visit the dental office do not actually pursue routine checkups with their primary care provider every year. It's important to know also that dental procedures typically increase blood pressure from both stress and the anesthetics used. So patients with a history of hypertension must have controlled blood pressure prior to treatment to prevent hypertensive crisis. And this is very important. Patients can be very surprised when a dentist is taking their blood pressure, but this is really a hugely important part of the dental profession in the modern day. And this is a perfect example of why dental professionals must work with medical colleagues to ensure that patients achieve optimal health. So we'll talk about the treatment phase of care. First, we talked about preventive. Now we'll talk about treatment. When disease is identified, treatment is indicated. And as we've talked about in earlier lectures, earlier treatment is much, much better and much more effective than later treatment of disease because it's easier, it's less invasive, and usually less costly as well. So, restorative care. This includes things like fillings, crowns, root canals, even deep cleanings, scaling and root planing, or denture and or partial fabrication. This is restoring the teeth that we have and maintaining them. Now, surgical care includes tooth removal or extraction, periodontal surgeries, or even implant placement. And yes, like any profession, at times, not all doctors would agree on the same treatment. You know, it can be confusing. It happens. Just know you are always entitled to a second opinion. Please educate yourself. What if I'm absolutely terrified of dental care? Well, many dentists do have options to help patients who suffer from dental fear, anxiety, or phobia. So let's talk about dental fear, phobia, and anxiety. I know you've heard these terms in our past lectures, but just know, fear is typically an unpleasant emotion anticipating pain or danger. A phobia is a strong, unreasonable fear of something. And anxiety typically means a worry or an uneasiness. Now, according to Colgate, 30 to 40 million Americans avoid the dentist because of anxiety and fear. And as I've mentioned in previous lectures, there isn't a good estimation of really how many Americans this is. It could be much, much, much more. So why are dental fear, anxiety, and phobia dangerous? Well, they cause patients to avoid dental care, which again worsens disease. They increase blood pressure during appointments, which also can be dangerous. They can create dangerous situations during treatment, like patients moving around. They could possibly injure themselves or even the dentist or allied healthcare personnel. It's truly an important thing to make sure that we combat these problems before treatment. So, what options do you have? Can't I just be put to sleep? Don't forget about things like distractive techniques, music or TV. Hypnosis is even an option at some offices. Nitrous gas, which is an inhaled conscious sedations. Pharmaceutical agents, which are typically oral conscious sedation, including things like benzodiazepines. But remember, these can come with addictive potential. And lastly, IV sedation, which again is a little more extreme because oftentimes it can be from conscious to unconscious sedation. Nitrous gas, conscious sedation, or laughing gas, is an inhaled agent mixed with oxygen used to relax patients and or reduce the gag reflex. It's safe for most adults and children, but it's not indicated for pregnant women or those with severe lung disease, sinus obstruction, histories of drug or alcohol abuse, because yes, it also can be an addictive agent, or those taking psychotropic drugs. This treatment is rapidly reversible and is metabolized in the lungs. But just remember, overuse or misuse of nitrous oxide can be extremely dangerous, and even this can result in death. Oral sedation. Oral sedatives or oral pills are an option for those with severe dental anxiety and or those with a big fear of needles. Diazepam, Valium, is the most common oral medication for this. Now, while some dentists or surgeons may prescribe these medications, others may recommend that you receive them from your primary care provider. And just remember, these medications do pose the risk for addiction. Now, alternatively, you typically are, you want to consent to treatment before you show up under the influence of one of these medications, and also you will need someone to drive with you or to drive you. So just make sure that if you are going to pursue one of these options, you have to discuss it with your doctor and plan it ahead of time. IV sedation. IV sedation in an operating room setting has become increasingly common for dental treatments and surgeries. Now, this procedure does pose risks to overall health, and the benefits of treatment must outweigh the risk of sedation. Remember, this is for patients with severe cognitive decline later in life, or children and adults with special needs that can't tolerate a conventional dental setting. IV sedation for restorative dental procedures should be offered only to those with the inability to tolerate conventional dental treatment with other methods. So just keep that in mind. That and again, this is not something that everyone can just go and have done. You have to meet the criteria for like weight requirements and even just your airway and whatnot, heart requirements, things like that. So you do have to be healthy in order to pursue this option. So the take-home message here, less is more. Dentistry has changed drastically in the last 30 years, and anesthetics work effectively and efficiently, and treatments can be much, much more comfortable for people. So the best thing that you can do if you come across a patient with anxiety, dental fear, dental phobia, recommend that they listen to music, practice mindfulness, and try to avoid potentially harmful agents. This really is the safest option. So what happens if you do feel pain? Post-op follow-up is an important component of treatment. Pain can occur before dental treatment and after. Well, we haven't talked about this just yet, but pain is best controlled using NSAIDs, things like ibuprofen, and acetaminophen, which is Tylenol, together, as long as no kidney or liver issues exist, and as long as you don't exceed the maximum recommended dosages for both of those medicines. Dentists have moved away from using opioids for pain management, as they do not treat the source of pain, they just mask the pain. And of course, they cause addiction. They have severe addictive potential and contribute to the opioid epidemic. And that is surely something that's affected most of our lives. So it really, really is important to move away from that type of pain management. So what sort of medical issues affect dental care? Well, all of them. Just remember, all medical issues affect your oral health, but also dental care. So it's extremely important to inform your doctor of what you're taking and what you might have. Heart diseases, cancers, autoimmune diseases, high blood pressure, pulmonary disease, mental disease, artificial joints, diabetes, osteoporosis, other infections, STIs, you name it, allergies, history of substance use, mobility limitations. There is so much that affects dental care. So, it's very, very important to discuss all of these possible, things with your doctor. Now, what kind of medications affect dental care? Again, all of them, even supplements. But importantly, blood thinners, psychotropic drugs, NSAIDs, immunomodulators, antidepressants, thyroid medicines, proton pump inhibitors, decongestants, allergy meds, pain meds, blood pressure meds, all of it is extremely important. And it can affect, your overall dental care and oral health. So it's very important to make sure your doctor knows of everything that you can take. And of course, if you have restrictions or allergies or things like that with certain medicines, it is very important to share with your dental provider all pertinent medical history. And just remember, this is an essential part of patient-centered care. We want this to be well-rounded, effective, efficient, culturally competent care. And so informing, sometimes the patient has to be really the center of the team and inform all of these other parties, which, without like an integrated medical record system, the dentist can't just know what a patient's prescribed by at their physician office, or maybe what they talk about with their therapist, or maybe what's going on with their home life, something that their social worker knows. So it's really important for the patient even to inform each party and each healthcare professional about what's going on. So, and for professionals, it's very, very important to ask the pertinent questions, ask the important questions about their lives, because sometimes patients won't tell you those things. So dental care is provided in a unique setting, often separate from medical facilities and hospitals. But again, the solo practice is changing into more group practices and even into hospital-based dentistry. Dental providers must work with team members outside the dental office to achieve the best possible care for patients. It is amazing what you can accomplish if you do not care who takes credit. Harry Truman. So thank you to our sponsors. We will see you next time. With questions regarding this module, please know you can email breckyhuddleston@gmail.com. And we'll see you next time for our last set of lectures in this oral health education series. Thank you.